Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Hernia, that is a modified Gilberts classification. So first we start with the type 1. So the type 1 is nothing but the indirect hernia. It is the indirect hernia and there is a presence of the peritoneal sac. So there is presence of the peritoneal sac and this passes. So it's passing through an intact internal ring. So it passes through an intact internal ring that will not admit one finger breadth. So it will not admit one finger breadth. So it does not include one finger breadth, and that is, it is less than 1 centimeters. Then the posterior wall, if you see, it is intact. So indirect hernia with peritoneal sac passing through the intact internal ring, and it does not permit the one finger breadth, that is the posterior wall, it remains is intact. Next we move on to the type 2. So another type 2, it is nothing but the indirect hernia. So there is indirect hernia. So here in indirect hernia, it is the most common indirect hernia and there is a peritoneal sac. There is presence of the peritoneal sac and it comes through a one finger breadth. So there is one finger breadth and there is a one finger breadth internal ring. So this is less than 2 centimeters and the posterior wall, it remains intact. So there is a posterior wall which remains intact. Then we move on to the third type. So in terms of the type 3, it is nothing but a indirect hernia. So type 2 was also indirect hernia with the peritoneal sac coming through the one finger breadth internal ring that is less than 2 centimeters. So here it is also an indirect hernia and there is a peritoneal sac. So the peritoneal sac, PS sac. So the P sac, it comes through a 2 finger breadth. So it comes through a 2 finger breadth. So it comes through a 2 finger breadth or the wider internal ring. So there is a wider internal ring. So that is, it is greater than 2 centimeters. They are frequently, it is complete or have a sliding component. So they are complete or they have a sliding component. They begin to break down a portion of the posterior wall. So bring into breakdown. So it breaks down a portion of the posterior wall. So it breaks down a portion of the posterior wall just medial to the internal ring. So medial to the internal ring. Next we move on to the type 4. So type 4 is nothing but a direct hernia. Type 4 refers to direct hernia. So type 2 and type 3 were indirect hernia. So type 4 is a direct hernia with a full floor posterior wall breakdown. So there is a full floor posterior wall breakdown and there are multiple defects in the posterior wall. There are multiple defects. So multiple defects are in the posterior wall and the internal ring is intact and there is no peritoneal sac. So the internal ring, it remains intact. So internal ring remains intact and there is no peritoneal sac. There is no presence of the peritoneal sac. Next we move on to the type 5. So what is meant by type 5? So type 5 is nothing but it is a direct hernia So type 5 is nothing but the direct hernia, and they have a diverticular defect. So it's a direct hernia with a diverticular defect. So there is no peritoneal sac and the internal ring, it remains intact. So there is no peritoneal sac and the internal ring, it remains intact. The internal ring, if you look at the internal ring, it remains intact. So even 5, how is it different from 4? 4 was the direct hernia with the full floor posterior wall breakdown or the multiple defects in the posterior wall. So internal ring, it remains intact and there is no peritoneal sac. Whereas in 5, there is a direct hernia with a diverticular defect and there is no peritoneal sac and the internal ring remains intact. Now 6 is when there is a direct. So it includes the direct and the indirect. So there is a direct and the indirect inguinal hernia. So direct and indirect inguinal hernia, or in short it is known as a pantaloon hernia. It is a pantaloon hernia. Now let's move on to the type variety 7. So what is the type 7? The type 7, it includes a femoral hernia. So type 7 is nothing but, it stands for the femoral hernia. To learn and grow daily like this, please do subscribe.